day one of my 6-week treatment, so we shall see how it goes. I'll talk to you soon or in the next part of this video. Now that I'm sitting in the chair, I'm getting nervous. I haven't started the IV yet, but any minute now. Okay. I will be back. So my chemo has started. So I'm finished for the day. I'm on my way home. I went through my chemo starting this morning, and they start me off with fluids because the chemo that I'm taking is very dehydrating. So they give me a bag of fluids for the first hour, and then they also started giving me what do they call it? Pre-meds medication before I start the chemo, I guess to help. And then they gave me a shot of anti-nausea medicine. And then about an hour after that, they started the chemo. And I was totally fine until about an hour before it ended. I got really sleepy and I fell asleep. I wasn't really surprised by that though, because I used to get infusions from my rheumatoid arthritis, and for whatever reason, whenever they hooked me up to the IV, it would just knock me out. Don't know why. So I kind of started feeling sleepy in the beginning when they just were giving me the fluids, which aren't even a medication. So I think it just has something to do with me and my body, because my body doesn't like taking fluids or any kind of medicine straight through the vein. I don't know, whatever, but that was the only thing. I woke up this morning with a stomach ache, and I had some issues where I wasn't throwing up, but everything was coming out the other end. So that was before I even started the chemo. So I had an upset stomach. Again, one of the side effects of the cancer. So it just comes and goes. Some days are better, some days are worse. Today was not a good day. My stomach has felt uneasy all day, but it started before I started the chemo. So honestly, I don't really think it's because of the chemo or the radiation. So after I finished the chemo, I went downstairs to the radiology area, and that's when I started my radiation. And it was different. I think I felt something. I felt kind of like, I don't know, maybe like a burning sensation, very light burning sensation for like a few seconds, maybe a minute. And I thought, is that, and it felt like it was around where my cervix would be, kind of thing. And I thought, that's probably the effect of the radiation, but I don't know. I see my doctor tomorrow after my second radiation, because I only do chemo once a week, and then I do radiation every day the rest of the week, except for the weekends. So tomorrow I have another round of radiation, and so on and so forth. But so far, knock on wood, I'm feeling okay. I just feel a little bit tired, which is what they said. But they did give me steroids with the medication that they gave me before. They give that to patients to help with the chemo and the side effects, as far as, the pain, I guess. They said that usually wears off in a few days. So you may feel great in the first 2 days until the steroids wear off. So we shall see. But I think I'm just going to be tired. That's what it seems like. But they did give me not over the counter, but a prescription pill medication, 2 different types for the nausea. So, because that is one of the biggest effects of the type of chemo that I'm getting, is the nausea. And it is one of the chemos that causes hair loss. However, I'm only going to be doing chemo for 5 weeks. So, and they said it's a pretty low dose because of the fact that the radiation is what is really going to be the target of killing the cancer, for the cervical cancer. And the radiation just helps with the the chemo helps with radiation, is what I'm trying to say. So that should be beneficial, and the benefits outweigh the side effects, which is why they do it. So that being said, there's a possibility I can lose hair. The doctor pretty much said that it's probably just going to be thinning out, like not won't all fall out. However, the specific chemo that I'm taking is the type that causes you to lose hair. And all over the sheets of information that I was given by the nurse who did the pre-class before I started chemo, he pretty much told me, yeah, you're going to lose your hair. And then reading all the paperwork, it pretty much is, yes, you're going to lose your hair. But when I asked the actual chemo oncologist, he said, no, you're probably just going to have thinning. And I thought, well, that's probably true since I'm only taking it for 5 weeks. But we shall see. I don't know. Honestly, I'm not really worried. If I lose my hair, it's going to grow back eventually. Although it might not for me. Kind of curious to see if it will or not. Because my grandmother had alopecia and she lost her hair in her late 30s and it never grew back. So I'm curious to know. Plus side note, as I was in the room getting my chemotherapy, I was listening to some people sitting around me talking, and one of the ladies there, 51, she had breast cancer, had both of her breasts taken off. And then, I don't know why, didn't hear why, but she recently when they were doing the checkups, they had a scan come back saying she had cervical cancer. But when they checked it, there was no cancer in the cervix. It was in her pelvic bone, and they said the cancer was wrapped around her pelvis. I was just like, wow, that is crazy. Anyway, and then there were 2 men, one sitting next to me and one sitting across from me. Both of those men that were there for colon cancer. And the one sitting to my right, he said he's been battling cancer for 10 years. It's been going from one place to another. And I think he said he was like 37, so he's pretty young. The guy across from me looked a little bit older, but still. The guy across from me said he had kidney cancer, and they took out one of his kidneys, and then they found colon cancer. So again, man, those abdominal cancers present themselves very differently than a lot of other cancers, is my guess. I don't know. I'm not an expert. I'm just telling you guys what I've heard and what I've found myself. Though I was early enough in my cancer, they said they found early enough that I think I wasn't really having major symptoms. They were still like in the early stages. It was only recently that I started having, well, that's not true. I guess within the last 6 months I started having stomach issues that were worse than normal. But again, I talked about changing my medicine and thought that would help, and it did for a while, but not totally. Anyway, long story short, man, you men need to keep an eye on it, because I know you guys do not want to get those rectal exams, which, if I'm not mistaken, those rectal exams are for prostate cancer, wrong organ, sorry. But those are for prostate cancer, and I know guys don't like it, but they're there for a purpose. You can't avoid it. You should not avoid it. You should not, because you want to catch it as early as you can. I know it sucks, but something that is very important. And those colonoscopies, because I believe it's once we turn 50 that they ask for a colonoscopy, maybe even earlier. You need to get them. I mean, I don't know how many men are watching this, but seriously, it seems to me lately that the people I've talked to or overheard seem to be men that are coming down with colon cancer. So if a colonoscopy can save your life, what is a few, days of, yeah, I know it sucks drinking all that crap and having to constantly go to the bathroom to clean yourself out. but they put you out when they do the colonoscopy, so you're not going to feel it, or knock on wood, you should not be feeling it. But it could potentially save your life, so suck it up. Oops. Accidental moving of the camera. Anyway, I kind of just wanted to let you guys know how it's going so far, and I will check back in with you tomorrow. Everyone take care and have a good day.